Hi, my name is Jason Coe, and I'm joined by Catherine Groves and Dr. Aaron Phillips for this video manuscript where we're going to introduce you to a tool called the Value Matrix. The Value Matrix is a tool that we've developed through the communications program at the Ontario Veterinary College for over the last 10 years, and we've been sharing with the veterinary profession through various continuing education opportunities for the past 10 years. And now we wanted to take this opportunity to put it into the video manuscript format to share with the broader veterinary profession, as it is a tool that can really help us engage our clients in a shared decision-making process, and it supports the practice of delivering the spectrum of care. A study by Janke et al. 2021 conducted through our lab evaluated the shared decision-making taking place between companion animal veterinarians and their clients using the Observer Option 5 instrument, which is an instrument adapted from human medicine that allows us to assess veterinarians' level of shared decision-making. In this study, there were 909 video-recorded veterinary client interactions that were first screened for preference-sensitive decisions. Preference-sensitive decisions are any time that there is a decision where the veterinarian could take into consideration the patient's and/or client's preferences or situation. Of the 909 interactions, 717 were identified to have a preference-sensitive decision. The conclusion from this work was that elements consistent with shared decision-making were uncommon within those 717 interactions. Recognizing that the decision-making process that happens between a veterinarian, a client, and involving a veterinary patient is complex, taking into consideration veterinarian medical knowledge, taking into consideration client values, preferences, as well as the client and animal situation. We started working with students at the Ontario Veterinary College with a tool called the Value Matrix to really assist this decision-making process. The first step in utilizing the value matrix is making sure that we gather a comprehensive history from our clients, a history that includes information about the animal and the client's environment, as well as information about the client, their values, preferences, what is important to them in the care for their animal, which can help inform the development of a value matrix. So the value matrix is a decision-making aid that is really intended to create a visual representation of the options, as well as the advantages and disadvantages associated with each of those options, as well as an opportunity to bring in the cost associated with each of the different options to really engage veterinarians and clients in a conversation around those options and to come to a decision that really integrates both the veterinarian's medical knowledge along with the contextual components of the client and animal situation and preferences. So hypothetically, let's imagine we were having a conversation with a client around a diagnostic or a treatment procedure that had at least 3 available options to our client. And so hypothetically, if we were to list those options onto a piece of paper or a whiteboard, such as option A, option B, option C, and then we introduced only the cost associated. So on the screen, we'll use a cost of 100, 500, 1,000. If you were the client, what would be your decision in this situation? Well, given that we've only presented the client with the cost of the 3 different options, clients are most likely to make a cost-based decision. And so if I were the client, likely I would go for the cheapest option available. However, we need to take a step back and recognize that the challenge here is that we haven't really communicated to the client the advantages and disadvantages, and in turn the value associated with each of those options so that they can make a value-based decision, which is where the value matrix can further assist us in supporting clients in the decision-making process. So now if I take that step back and I present our clients with option A, option B, option C on a piece of paper or a whiteboard along the left-hand side, but then start to highlight both the medical benefits for the patient as well as considering some of the client benefits associated with each of those options that we've drawn from the conversation. We've gathered information through our comprehensive history. We start to build a value matrix, which then starts to illustrate not only the options and the cost, but the options, the advantages and disadvantages of each of those options in relation to each other, which then we introduce the cost. A client can look at the cost and see not only the cost, but the value associated with each of those costs so that they can take all of that into consideration. What we like to do now is provide a demonstration of the use of the value matrix in a clinical scenario where we will have Dr. Aaron Phillips be our veterinarian and Catherine Groves be our client. And our clinical scenario involves Maggie, a 6-year-old female spayed beagle. So the first thing Dr. Phillips has done is gathered a comprehensive history from Catherine about Maggie and their situation. And through gathering that comprehensive history, we learn that Maggie has a good temperament at previous appointments, has no previous health concerns on record. As we explore the environment, we learn that Maggie and Catherine live in an apartment, that they use an elevator to access their apartment, and that there's a dog park nearby that they visit on a daily basis. When we start to explore a little bit more about Catherine's beliefs, values, we learn that Catherine's a university student. There's a strong relationship or bond between Catherine and Maggie. There are transportation challenges for Catherine in terms of getting around and getting to the veterinary clinic, and yet Catherine's very interested in providing the best possible care that she can for Maggie. On physical exam, Dr. Phillips identifies that Maggie has a grade 3 out of 6 left-sided heart murmur, and yet no other clinical concerns are identified on the physical exam. And so now we wanted to take an opportunity to pick up the conversation where Dr. Phillips is utilizing the value matrix to go over the diagnostic options that exist for Maggie and Catherine, and to support a shared decision-making process in coming to a decision on which diagnostics to pursue next, utilizing the value matrix.
Now that I finished with my physical exam of Maggie and relayed my findings to you, I want to present you with different diagnostic options for investigating Maggie's heart murmur. And I'm going to do it using something called a value matrix, where I list each of the diagnostic options for investigating her heart murmur, and then I talk about different aspects of each one of the diagnostics. And in each of the columns, if I write a check mark, that means that that diagnostic has an advantage. And if I write an X, it means the diagnostic does not have that advantage. How does that sound?
That makes sense.
Okay. So starting with our first column here, our first option we have is not performing any further diagnostics. The second option is performing something called a cardiopet proBNP, which is a blood test that looks for stretch of Maggie's heart muscle, and we can detect that in her blood. The third option is thoracic radiographs, so we can look to see if her heart is enlarged, but it doesn't give us detailed information on the structures in her heart. And then our last option is an echocardiogram, which is an ultrasound of the heart that gives us detailed information on the structures in her heart.
Okay.
So moving to our first column, we're going to compare each diagnostic's ability to confirm the cause of her heart murmur. Now, based on Maggie's age and on her breed, the most likely cause is something called degenerative valvular disease, which is a condition where the valves of her heart don't work as well, and so blood will leak through the valves every time the heart pumps.
Over time, this leakage will cause the left side of her heart to become larger, which, when large enough, will lead to congestive heart failure.
Knowing this information can help us determine prognosis or treatment for Maggie. There are potentially other causes of heart murmurs in dogs, but valvular disease is the most likely one. And if you'd like to look up more information about valvular disease when you go home, I'm happy to provide some resources for you. So comparing each diagnostic's ability to confirm the cause of her murmur, if we look at no diagnostics, it won't be able to tell us the cause, as well as the proBNP and the chest x-rays. The only option that can confirm the cause of her heart murmur would be an echocardiogram. What questions do you have?
Don't have any so far.
Okay. Now, before I move on to the next column, would you be interested in hearing about the diagnostic's ability to determine if Maggie would need treatment?
I'm very interested in learning about that. I just want to help her and see if she does need to be treated.
Okay, perfect. So moving on to our third column, we're going to compare each diagnostic's ability to identify if treatment is needed for Maggie. So no diagnostics would not be able to identify that. And the proBNP also wouldn't be able to give us that information. What we're really looking for is knowing if her heart is enlarged, because if her heart is enlarged, then she's at more risk of developing heart failure in the future. And if we can implement treatment early on, we may be able to slow the progression of heart failure. So our chest x-rays does tell us if her heart is enlarged, so whether she needs to start treatment. And even better yet, our echocardiogram could give us this information as well.
Okay.
Next, we're going to assess each diagnostic's ability to determine the risks that Maggie will go into future heart failure. So comparing our diagnostics, so again, our no diagnostics would not be able to give us that information. Our proBNP could give us a little bit more insight if the value is normal, but if the value is high, we wouldn't be as certain about her risk of heart failure in comparison to chest x-rays, or even better yet, an echocardiogram.
Okay.
Knowing this is important because then we know how likely Maggie's heart disease is to progress, and also how closely we should be monitoring her.
Okay.
Moving on to our next column, we're going to compare the diagnostics potential for risk or stress to Maggie, and which ones have the least amount of stress and risk for her. So looking at no diagnostics, this would be the least stress and risk to Maggie. Looking at the next option, the proBNP, there's a little bit more risk there because we are taking a blood sample, but we know from past experience, Maggie's been very comfortable with getting blood tests done, so I don't think she'll mind that too much. And then for our chest x-rays and echocardiogram, both of these have a little bit more risk or potential stress to Maggie because they both may require sedation and for her to stay in the clinic for a few hours.
Okay.
Now I've left this next column blank because I'd like to know what benefits you think are important in a diagnostic that we can add to our value matrix. So what would you like me to add?
Well, I don't have a car and my schedule's really full with classes, so I'm curious if I have to come back to the clinic for any of these options.
So it sounds like convenience is something that is important to you, want to add. Okay, I will add that here. All right, so comparing each diagnostic's convenience. See, no diagnostics would be very convenient, as well as the proBNP, as we could get that performed today, and then you could leave shortly afterwards. Looking at our next options, chest x-rays would be less convenient as you do have to come back another day. We wouldn't be able to do it today, so you have to come back and Maggie would stay in the clinic for a few hours. The echocardiogram would be the least convenient because you have to go to a specialist to get that done, and it is a bit of a far drive. What questions do you have for me?
Well, how far away is the specialist?
It's about 2 hours away.
Okay, wow.
For our last column, we're going to review the cost of each of the diagnostics. So for our no diagnostics option, that is the least expensive. It's no additional cost on top of our visit fee. For the proBNP, the cost is about $106 on top of the visit fee. For our chest x-rays, it's about $450 on top of the visit. And then for our echocardiogram, it's $866 plus our visit fee. What questions do you have?
What do you recommend?
Based on our discussion today and your concern for convenience being important to you in choosing a diagnostic option, I am concerned that it might be hard for you to go to see a specialist if they're quite far away, and convenience is important. So I think based on that information, the thoracic radiographs might be the option I would go with for you and Maggie.
Okay.
What are your thoughts?
Well, I think given that I don't have a car, the radiographs are probably the most realistic for me and Maggie in getting her back to get that diagnostic information. And I am a student, so that is a better price point for me to work with and budget. So I think we will go with the radiographs.
That sounds good.
What are our next steps?
So hopefully you're able to draw from that example the possible opportunity that the value matrix offers us as veterinarians for engaging our clients in a shared decision-making process and really presenting clients with the spectrum of care as it relates to diagnostic or treatment options. The value matrix is a tool, and I encourage you to consider how it might fit into your practice of veterinary medicine and conversations with clients, recognizing that the entire value matrix illustration may not be used for every decision-making process with a client. You may find that you just use it to organize your own thoughts and thought processes so you can deliver a much more structured presentation of options to a client. You might even just use the putting of the options onto a piece of paper or a whiteboard so that a client can do a better job of tracking what the different options are. Because often by the time you get to option 3, the client's lost sight of what option 1 was, and so it becomes very hard when we're just verbally sharing that information for clients to track. When we do use a full value matrix, it does create an opportunity to enhance client recall and understanding, where we can take a picture of the whiteboard or hand the client a copy of the value matrix that they can then take away, process, and think about in the context of the decisions that they may want to make. It also is another way of ensuring that we're achieving most, if not all, elements of informed consent. So if you look at the different components of the value matrix, it really is hitting many of the elements that we as veterinarians have a responsibility in terms of achieving informed client consent with our clients. The value matrix also provides a great opportunity for taking a picture of the sheet of paper or the whiteboard and putting that into your medical record to really record your conversation around informed client consent. And so if you look at the value matrix, it really is covering many, if not all, aspects of achieving informed client consent, offering another aspect of what the value matrix offers not only our client, but us as veterinary professionals. In addition to being a valuable tool we can use for engaging clients in the shared decision-making process and presenting the spectrum of care, it also can be a great tool to work with your practice team to really get your team on the same message as to what are the options, but also what are the value messages associated with each of those options. And so I often encourage people to think about what are some common diagnostics or treatment procedures that your practice might offer. Sit down and actually go through the process of building a value matrix with your practice team, which really allows people to think about, well, what are the available options for our client? What is the value associated with the advantages or disadvantages associated with each of those options to get people on a consistent message? And so at the end of the day, again, the value matrix is a tool that we've developed through the communications program at the Ontario Veterinary College, really to support student veterinarians, veterinary professionals in their conversations with clients and ensuring that we are engaging clients in a shared decision-making process, which really allows us to take into consideration the client's situation, their animal, their environment, incorporate that contextual element into the care that we're offering by providing a spectrum of care for our clients. If you're interested in learning more about the value matrix, its purpose, how to use it, we direct you to the book Developing Communication Skills for Veterinary Practice by Shaw & Co. 2024. We hope this video manuscript has been helpful in introducing you to the value matrix and look forward to how you might apply it to your own context in veterinary practice. We'd be very open to receiving your questions or feedback on the value matrix through our lab's website, which is www.rcvm.uoguelph.ca.